on here. Are we live? Here we go. Julie just got stood up, not by a date.
No date would ever stand me up because trust and believe
she's
that
a
would be
lot.
the end of it. End of it, I tell you. Unless you're in the hospital,
Unless you're dead.
well, that's too close to home. So this is video. There's no patient information on here. Can you that they can see it or no?
Put it up. I don't know.
Vivio. If you have a thing that says Vivio, you are
Do
screwed.
you remember the other day when I figured it out though?
Yeah,
Like
I don't
within
know.
2 minutes.
I don't know.
Buddy.
Can you read that?
Yeah.
Anyway, if you have something that says Vivio on it, I don't know how this is working.
I don't know, but we need to get your Twitter on here too, since your Twitter's hot.
Here, do it.
Well, let's see. Add. I just need, hold on. Ethics.
Look.
I know. I figured it out.
Wow.
Isn't that cool?
Yeah.
But oh, now it's gonna start going. I know. I figured it out. Isn't that cool? 3 people are watching. I guess one of them already did it. Well, you just watched it.
I haven't seen the video thing.
That's because we're past it.
Oh, we did?
Jerome.
Who? Jerome or Bunny?
Romy.
Romy. We don't want any of them.
Romy is
If you have
panicking.
Vivio, you're screwed.
Oh, maybe he needs.
He's on lunchroom duty. What are you guys doing? If you have Vivio, your patients,
Vivio and Julie even gave him a last ditch effort.
the Pramod John,
His first name's Pramod.
Pramod, Pramod. He emailed me.
He
and
said, just give us a chance.
And I gave him a chance. And he talked about in this email, which I will also, we're going to do a whole thing on.
We need to, yeah.
We're going to do a whole thing on this. He told me about how just give him a chance because their appeals process is real easy. Who is it? Done. He said it's we have such easy appeals if things don't go your way. They're not going my way. They're not going the patient's way, you moron. Okay?
This is the same person who went up on stage and they were like, if you have any questions, please come up. And Julie just stands up before they even ask if anyone has questions, ready for the mic. And she goes, Pramod, it's very hard to have a conversation with somebody that doesn't respond to emails. And he was just like, I don't think I got your email.
Well, let me look into that. Let me see how much I've ghosted you. So anyway, now I have the school's email. And he did email me and say, just give us a chance. Do you understand that this patient is on Enbrel and the Vivio wizardry that they call it? They want the patient to non-medical switch to Inflectra, which is an infusion drug. This is a patient that is 67 years old. She works at 7-Eleven in a store.
Do you think she gets to pick her hours?
And do you think she can spend 2.5 hours infusing here?
Not working at the gas station, going under?
Right.
And she has Slurpees to serve.
And she's putting her job on the line.
Just to make it to treatment.
And these morons right here
don't even give her a free Slurpee.
So anyway, they deny it. They deny what the patient needs and wants.
Hi, Jack.
And I file an appeal. They set up a peer-to-peer with one of my clinicians for 12:30 today. Guess what? They no-showed me. Bad idea.
Is that the second time?
The second time we've had a peer-to-peer no-show, but first time on Vivio.
I feel like
first time, long-time listener, first-time caller. Are you there? It's not Vivio. Okay.
Let's see. Keep going.
I literally want to rail.
What is Vivio?
Okay, so
we're live on both.
Vivio. Vivio. It's an interloper that sits in between the patient, the physician, and the insurance company. And they want one size fits all for their stupidness.
Sorry.
Okay? Rheumatology patients with arthritis, patients with lupus, patients with autoimmune diseases, they are not even close to one size fits most, much less one size fits all.
Biosimilars does not mean biosame.
It does not. And this isn't even close. This patient is on a self-injectable.
Could we charge them a no-show fee?
They're not gonna pay us.
I know people all the time are like, just send him a bill for your time. And then we take him to collections or small claims court. I'm like, if I marry a lawyer, definitely I will fill his time with lawsuits I would like to start.
First
But,
of all, it would cost you about $100 to file a small claims action.
and that's all.
And they're
that's
not-
my entire time of work that I would
You
be asking
might
for.
have lipstick on your teeth. Yep, sure do. And you're welcome.
Because my lips are dry.
It's because you're not wearing lip sense. Lip sense is-
dries my lips out even more.
But that's because you're not using it every day. Let's go back to this railing on VIVIO.
VIVIO.
EIEIO.
Literally.
Right? Okay, so this guy, originally when I dusted up with him was in 2021. And I would like to say, and I don't really honk my horn that much, I don't think, but I'm going to honk it right now.
Beep, beep.
I was, not beep, 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 Anyway, I was 100% responsible for VIVIO, VIVIO, losing the Southern Towing contract. Because I have a patient that I've had for a long time who's a captain at Southern Towing, and they got tangled with me, and we went at it.
Speaking of employers, if your employer is using SaveRx, Save on SP, Shark, send us a message. We'll message your employer.
We would love to message your employer.
And
We would
we'll
love
shout 'em
to
out.
educate and advocate for your access to care, because these interlopers are horrid. They are siphoning healthcare dollars that are supposed to be direct patient care dollars between the physicians, the pharmacists, and the patients doing the work to their dumb selves. No, not doing it.
How is that covered under the employer using their fiduciary responsibility? Because if anything, they're not delegating funds correctly.
Well, he claims they're partnering with their plan. Okay, Michelle Lee, Farm D,
You can
NPI
suck
number.
mine.
I'm not gonna say it. She was supposed to do this, but she didn't do it. She didn't call.
That's because they probably have notes, and she's like, "I'm just a pharmacist, man. I don't want to talk to them."
Yeah, I wouldn't want to talk to me either. I'm kind of sick of me myself.
No parler français.
Yeah.
Los soiree.
VIVIO, optimal outcomes at the lowest
Optimal
cost.
outcomes to the casket.
Optimal outcomes? How about no outcomes? The patient doesn't want this medicine. The doctor's office doesn't want this medicine.
They don't want to
Who
use
in the hell
SaveRx, Save on SP, Vivio either. They just want to go to the doctor, get their prescription sent, and pick it up from the pharmacy without any issues.
This is garbage.
No.
And then they send us this fax and say, agree or reconsider on this switch.
Do you agree
Or
or
should we file an FDA MedWatch report because you're screwing with these patients' lives? This is such a bunch of crap.
I'm still trying to figure out you two's purpose. I have none. I have no.
I can
purpose.
tell you what my purpose is. My purpose is I want a pathway to care for my patients. My patients are super medically complex, they're chronic, and they deserve individualized therapy plans. You give me a pathway to care for my patients, I get off your Dick Van Dyke.
I don't.
That's my purpose right here, right now.
I'm just
Damn
here
it.
to talk loud.
I am like super incensed that these people blew me off. And I emailed him and he didn't even email me back.
That's healthcare.
That is healthcare. Like the
Well, and that's what I was telling one of our medical assistants, because she's like, if they're out, should we send it? Because we already sent it. And I was like, no. Like other doctors' offices, you send a request. I still haven't heard about my Adderall 30 XR. And it's just like they take more than 3 days.
they take 10 days.
So I feel like we need to make it a thing. Like, give us 72 hours. If you call more than once about pain medication in 72 hours, you're getting referred to pain management. And that's that.
Oh my God.
What?
Okay. Another stigma bullshit. Damn.
Big no care.
Okay. 330-126.
So they're having Julie filling. I'll send them a $500 no-show fee. How do you do that, Jack? Hi, Wyatt.
All right. Now Cigna gave us a continuity of care for 1 year. And what did they do?
Denied
They
the patient's med.
turned around and denied it. Yeah. Okay.
They're like, so we talked to you,
It
wasted
is
your
in
time,
her
and we're
chart.
denying it. Hi, St. Felicia.
It is in her chart.
I heard a lot of people have
Friggin'
been having
healthcare.
trouble with getting their medication approved
Well, let's see.
with the same reasoning.
Under
Hi, hello.
10.
Do you have issues with TRICARE? Yes.
17,
Yes.
24.
TRICARE is really hard because one, who wants to have a pissing match with the government? Nobody. They make the rules. It's kind of like Medicaid or
Okay.
how's little Jer Bear?
Chair Bear.
He is perfect. He is perfect, just like his mother.
Where can I see?
Look at he's just passed out. You're retired Army. Thank you so much for your service.
How much do I hate steak? Now I'm emailing this to that stupid ass David Cordani.
We're gonna have David Cordani cups coming out.
Yeah.
Looking for
We're
him.
happy to help.
But
Mark V.
I kind of do want to stick my foot into helping veterans advocate because I think that would be very self-fulfilling. I know you're not supposed to do things to self-fulfill yourself, but I think it would help my heart.
I hate
Cigna.
I hate Cigna.
They made no.
I'm actually going to. Do you understand that this moronic company, Cigna, sent me a continuity of care for this patient until April 7th of 2025, and her husband works for the Florissant Valley Fire Protection, and they
I know her.
Yes, and they denied her office visit.
I don't hope, but if the house just so happened to catch on fire and nobody showed up,
God, wouldn't that be sad if
next we're gonna get caught in trouble for plotting.
right. If something happened to.
Did you see UHC doubling down on them doing the right thing for unnecessary care?
No, what does that mean?
I would Google United Healthcare statement.
Oh,
They changed their statement from the we suggest you tune out that critical noise and changed it to they only told employees that nope, you accidentally came on a press conference.
What does it say? United Healthcare CEO murder no. Oh,
John.
John just emailed
Mr. John,
me.
is he on TikTok?
I just checked with our team. They called Christy Moore. Well, they're morons. Well, they are fools.
Yes, please provide the
They
link.
were told
That was
to
their
call
statement on their practices.
the
Exchange.
physicians line at 314-280.
They're following the CEO's
3687
legacy and
and
continuing
speak
to deny unnecessary care.
Christy Schulte.
I love that. It's hilarious. I mean, my
We
thoughts and prayers are out of network.
waiting. Well, they're fools. They were told to call the physician's line and speak with Christy Schulte.
Hi, Alex. Oh, and we're up to 10. Hey, Amanda, she found us from TikTok. And then onto Twitter, so she's on here. And it works. This is crazy. They're not going to pay my dad's Dexcom G7 Centers for Medicare, Laura said. That's your college roommate, I think.
Who, Laura?
Thornhill?
No.
Oh,
No.
sorry.
Okay, so they called Christy Moore NP working with Daniel
That's our
Mastis.
office number, though.
Yeah, and got a message that the office is closed and already asked her schedule to reschedule. Was there an issue with the number we called? Yeah, it was. Well, they're fools. They were told to call the physician's line and speak with Christy Schulte. It doesn't matter. I never would tell them to call that.
No, I was thinking how that would happen.
No.
Or are, for that matter.
Yeah.
I feel bad for the family for losing a loved one, but that's it. I'm not sorry for him. His family's
His family's fine. They have $47 million.
He had a girlfriend. So, and I assume, this is just my assumption, that he was a jackass.
I don't know why it wouldn't be. You're 50 years old.
You have a girlfriend. You have $3
$10.2 million. Two kids. Unless the girlfriend had baby daddy. Maybe the girlfriend's gonna come up.
A lot of headlines over here about a health boss that was shot dead over there. He was Robin Hood. I would like to talk to some other countries' news outlets because America isn't interested.
Where is the statement?
Look up their hold on.
UHC
Their statement on their practice.
Statement on practice?
Yep. That they still stand by denying.
Practice of denials. I don't think that's gonna work.
It did.
It says 5 days ago,
When did he die?
the 4th of December.
So 5 days. When was it? Google Andrew Whitty statement unnecessary care.
Okay. Andrew Whitty.
4 hours ago. Thank you, Stephanie.
Whitty statement
Why?
today. Okay, let's see. Oh, somebody says Andrew Whitty to be next.
Oh God.
Okay.
We have Whitty walkers.
That's
been going.
amazing.
Don't you have Social Security in US?
It's an open threat to another CEO. That's amazing.
I'm surprised our faces haven't.
Andrew Whitty to be
Yeah.
next. Open threat to CEO on social media says, after he says, wow. Oh no, I don't want to go on the app. God damn it.
They're like, please subscribe to the app.
After the brazen killing of UHC CEO Brian Thompson, which was celebrated on social media in a sinister trend, some users
It's not sinister. Then denying claims is
To be
sinister.
next, after his internal speech to the company staff got leaked and went viral.
Just-
Amazing.
Just tune out this critical noise we're hearing because it's lies.
It was during his speech to the staff that Whitty said that the company would continue to prevent unnecessary care, which means dubious health insurance claims. That drew flack from social media users who were celebrating the murder of Brian Thompson. They said Whitty should be killed next.
Whitty doesn't have very many wits to him, does he?
I absolutely love this. This is from MSN. This is crazy. Crazy. Our role is a critical role.
It's not.
Bullshit.
It is not.
One user said he's glad that the killer is still on the loose. Oh,
He's
well, that's
not,
too bad.
though.
He's not.
He might be though, because the guy looks very different. If you look at the pictures.
I don't know. Okay. I don't see Andrew Whitty to be next. It's so amazing.
That's hilarious.
Um,
I do not condone death onto anybody, but if nature feels like doing its job,
should Whitty be next?
should I
Wow.
use my wit to care? No.
I'm not seeing Andrew Whitty's statement today. Let's see. What's today? 12/11?
Yep, he is the one
24.
that got shot, but it was an inside job, and the guy got caught with Monopoly money in his book bag. Well, he didn't get caught with it. They found the book bag and it had Monopoly money. This literally sounds like a freaking movie.
I'm here for this movie. I am here.
He's not a hero. But you want to know who is? Luigi.
I'm Team Luigi. I don't see the statement. I don't get it. I've done Andrew Whitty's statement, 12/11/2024.
Aaron Gibson.
UHC
Are you a doctor, Aaron
president.
Gibson? I feel like you might be Dr. Gibson.
President.
Am I just making things up? Probably.
Yeah, this doesn't say anything.
We're really good at ticking people off, though. We had Save on SP, Save RX. That's all of them, I think.
Video.
We're all talking about us and saying, don't. I think it was leaked. It was his leaked video, but his statement to his employees. Oh, yeah, we saw that. Please tune out the critical noise you're hearing.
Yeah, but I didn't know there was a new one.
It's
So there's not.
amazing.
Look at Jerome. Does he have cigarettes in the zipper?
No, I was going to put weed in there.
Good. I think that we should message this new guy and text him and see if he's. Let me do it.
No.
Why? Why?
For a second, I thought she was talking about the new United Healthcare person. I'm like,
Do you have his phone number?
you want what? I have his number? No, because it's the lure. Kids these days, if you don't have a lure, you won't get them at all. Dan didn't give him a lure. Now look at him. Random free. Except he did send me a picture of his little Christmas tree and said it needed decorating. And I was like, Drummond, I want to.
God, these people are so stupid at Vimeo. So
It sounds like the
stupid.
TV. I think it is Vizio maybe actually. OMG, I didn't see Jerome. He blends in. He is hot. I'm starting to sweat. I can't believe I got it to work on to freaking Twitter and
So-
YouTube.
This is the Vivio update, okay? Remember, if your company has Vivio, VIVIO, you're screwed.
Tell them you want to.
7-Eleven employees have this. And I emailed them because they want to switch the patient from
You don't
Embra.
play Monopoly alone. Dot, 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 dot.
Me?
No, about the guy, Luigi's book bag being found with Monopoly money.
Oh,
And someone said, you don't play Monopoly alone.
you don't. You don't. I said, hey, promote. Your denier for hire stood up my clinical team on the peer-to-peer, so guess your appeals are not so easy. Guess I'll write to the employer 7-Eleven. He's like, I just checked with our team. They called Christy Moore. Wrong, Christy.
Hello.
Yes? Yep, I'll be right there. Thank
All
you.
right, and that's the end.
That
We'll
is
see you
the end.
soon. I'm so glad.
Wow, it's 1 o'clock already?
Oh, I need to go down.